Working with physical pain. Your pain is not you. The next time you hit your thumb with a hammer or bang your shin on the car door, you can perform a little experiment in mindfulness. See if you can observe the explosion of sensations and the expanding shell of screamed epithets, groans, and violent body movements that ensue. It all takes place within a second or two. In that time, if you are quick enough to bring mindfulness to the sensations you are feeling, you may notice that you stop swearing or yelling or groaning and that your movements become less violent. As you observe the sensations in the hurt area, notice how they are changing, how sensations of stinging, throbbing, burning, cutting, rending, shooting, aching, and many others may now in rapid succession through the region, blending into each other like a play of multicolored lights projected willy-nilly on a screen. Keep following the ow of sensations as you hold the area or put ice on it, or put it under cold water or hold it above your head or whatever you are drawn to do. In conducting this little experiment, you may notice, if your concentration is strong, a center of calmness within yourself from which you can observe the entire episode unfold. It can feel as if you are completely detached from the sensations you are experiencing, as if it were not your pain so much as just a pain. Perhaps you felt a sense of being calm within the pain or behind the pain. If you didn't, you can always try it again the next time you are unfortunate enough to bang some part of your body really hard. Hitting your thumb with a hammer or banging your shin on something brings on immediate pain. We use the term acute pain to describe pain that comes on suddenly. Acute pain is usually very intense, but it also only lasts a short while. Either it goes away by itself, as when you bang your body, or it forces you to take action of some kind to make it go away, such as seeking medical help. If you try to bring mindfulness to exactly what you are feeling in those moments when you hurt yourself accidentally, you will probably find that how you relate to the sensations you experience makes a big difference in the degree of pain you actually feel and how much you suffer. It also affects your emotions and your behavior. It can be quite a revelation to discover that you have a range of options for dealing with physical pain, even very intense pain, aside from just being automatically overwhelmed by it. From the standpoint of health and medicine, chronic pain is a much more intractable problem than acute pain. By chronic pain, we mean pain that persists over time, and that is not easily relieved. Chronic pain can be either constant or it can come and go. It can also vary greatly in intensity, from an excruciating to dull and aching. Medicine manages acute pain far better than it does chronic pain. The underlying cause of an acute pain can usually be identified rapidly and treated, resulting in elimination of the pain. But sometimes pain persists and does not respond well to the most common remedies for pain, namely drugs and the surgery, and its cause may not be well defined. If it lasts more than 6 months or keeps coming back over extended periods of time, then a pain problem that started out as acute is said to have become chronic. In the rest of this chapter and in the one that follows, we will be discussing chronic pain and the specified ways in which you can use mindfulness to cope with it. It is important for the reader to keep FMLI in mind the fact that all patients who are referred to the stress clinic have had a full medical workup before they are permitted to pursue the meditation training. This is absolutely necessary in order to rule out or confirm disease processes that may require immediate medical attention. Listening to your pain includes making intelligent decisions about obtaining proper medical attention. The work of mindfulness needs to be carried out in conjunction with all the other medical treatments that may be required to relieve pain. It is not meant to be a substitute for the medical treatment, but it can be a vital complement to it. Just as we saw earlier that stress per se is not bad, it is important to remember that pain per se is not a bad thing either. Pain is one of your body's most important messengers. If you didn't feel pain, you could do great harm to your body by touching a hot stove or radiator and not even know it. Or you could have a ruptured appendix, for example, and not know that anything was the matter internally. The acute pain we experience under these and similar circumstances tells us that something is the matter. It tells us in no uncertain terms that we need to pay immediate attention and to take action in some way to rectify the situation. In one case, we quickly withdraw our hand from the stove. In the other, we get to a hospital as quickly as possible. The pain literally drives our actions because it is so intense. People born without intact pain circuitry have a terrible time learning the basic safety skills that we all take for granted. Without our knowing it, our experiences with physical pain over the years have taught us a great deal about the world and about ourselves and our bodies. Pain is a very effective teacher, yet if you were to ask, my guess is that most people would say that pain is categorically bad. As a society, we seem to have an aversion to pain, even to the thought of pain or discomfort. This is why we are so quick to reach for medicine as soon as we feel a headache coming on, and why we shift posture as soon as a little muscle stiffness generates some discomfort. As you will see, this aversion to pain is an obstacle to learning how to live with chronic pain. Aversion to pain is really a misplaced aversion to suffering. Ordinarily, we do not make a distinction between pain and suffering, but there are very important differences between them. Pain is a natural part of the experience of life. Suffering is one of many possible responses to pain. Suffering can come out of either physical or emotional pain. It involves our thoughts and emotions and how they frame the meaning of our experiences. Suffering, too, is perfectly natural. In fact, the human condition is often spoken of as inevitable suffering. But it is important to remember that suffering is only one response to the experience of pain. Even a small pain can produce great suffering in us if we fear that it means we have a tumor or some other frightening condition. That same pain can be seen as nothing at all, a minor ache or inconvenience, once we are reassured that all the tests are negative and there is no chance that it is a sign of something serious. So it is not always the pain per se, but the way we see it and react to it that determines the degree of suffering we will experience. And it is the suffering that we fear most, not the pain. Of course, nobody wants to live with chronic pain, but the fact is, it is very widespread. The costs to the society as a whole from chronic pain as well as to the people who suffer with it are very high. It has been calculated that lower back pain alone costs our society approximately $30 billion per year in treatment and lost productivity. The psychological costs in terms of emotional distress are staggering as well. A lingering pain condition can be totally disabling. Pain can erode the quality of your life. It can grind you down bit by bit, making you irritable, depressed, and prone to self-pity and feelings of helplessness and hopelessness. You may feel that you have lost control of your body and of your ability to earn a living, to say nothing of enjoying the activities that usually give pleasure and meaning to life. What is more, the treatments for chronic pain conditions, while indefinitely better and more sophisticated than they were even 20 years ago, are all too often only partially as successful. Many people are ultimately told by their doctor or by the staff of a pain clinic at the end of a long and often frustrating treatment course, sometimes involving surgery and usually numerous drug treatments, that they are going to have to learn to live with their pain, but too often they are not taught how. Being told that you have to learn to live with pain and should not be the end of the road. It should be the beginning. In the best of cases, which is probably still the exception rather than the rule, a person with chronic pain will receive the ongoing support of a highly trained multidisciplinary pain clinic staff. Psychological assessment and counseling will be integrated with the treatment plan, which might include everything from surgery to nerve blocks, trigger-pointed injections with steroids, intravenous lidocaine drips, muscle relaxants, analgesics, physical and occupational therapy, and, with luck, acupuncture and massage. The goal of counseling is to help the person work with his or her body and to organize his or her life to keep what pain there is under some degree of control, to maintain an optimistic, self-efficacious perspective, and to help the person engage in meaningful activities and work within his or her capacity. In our hospital, the pain clinic refers many of the patients it treats to the stress clinic for meditation training. The deciding factor in who is referred is the willingness of the patient to try to do something for himself or herself to cope with some of this pain, particularly when it has not responded fully to medical treatment alone. People whose attitude is that they just want the doctor to exit or to make it go away are not good candidates. They won't understand the need to take some responsibility themselves for improving their condition. They might also take the suggestion that the mind can play a role in the control of their pain to mean that their pain is imaginary, that it is all in their head in the first place. It is not uncommon for people to think that the doctor is implying that their pain is not real when he or she proposes a psychological approach to pain therapy. People who know that they are in pain usually want to have something done to the body to make the pain go away. This is only natural when the model you are working with is that your body is like a machine. When something is wrong with a machine, you find out what the problem is and you exit. By the same token, when you have a pain problem, you would go to a pain doctor, expecting to get what is wrong fixed, just as you would if something were wrong with your car. But your body is not a machine. One problem with chronic pain conditions is that often it is not clear exactly what is causing the pain. Often doctors won't be able to say with certainty why a person is experiencing pain. The diagnostic tests, such as X-rays and myelograms and CAT scans, frequently don't show very much even though the person is in a lot of pain. And even if the cause of the pain were known precisely in a particular case, surgeons rarely attempt to cut specified nerve pathways to lessen pain. This is only attempted in cases of unremitting, excruciating pain as a last resort. This kind of surgery used to be performed more frequently, but it usually failed for the simple reason that pain messages do not travel in exclusive and specific pain pathways in the nervous system. For these reasons, people with chronic pain conditions who seek medical treatment thinking of their body as being pretty much like an automobile, and that all the doctor needs to do is to find out why they are in pain and then make it go away by cutting the right nerve or giving them some magic pills or injections, are usually in for a rude awakening. Things are rarely that simple with chronic pain. In the new paradigm, pain is not just a body problem, it is a whole systems problem. Sensory impulses originating both at the surface of your body and internally are transmitted via nerve fibers to the brain, where these messages are registered and interpreted as pain. This has to happen before they are considered painful by the organism. But there are many well-known pathways within the brain and the central nervous system by which higher cognitive and emotional functions can modify the perception of pain. The system's perspective on pain opens the door for many different possible ways to use your mind intentionally to influence your experience of pain. This is why meditation can be of great value in learning to live with pain. So, if a doctor suggests that meditation might help you with your pain, it does not mean that your pain is not real. It means that your body and your mind are not two separate and distinct entities, and that therefore there is always a mental component to pain. This means that you can always influence the pain experience to some extent by mobilizing the inner resources of the mind. Pain outcomes in the stress clinic. Before looking further into the ways we can use mindfulness to work with pain, we will review some of the results obtained from our studies of people with chronic pain conditions in the stress clinic. These studies have shown that there is a dramatic reduction in the average level of pain during the 8-week training period in the clinic, as measured by a pain questionnaire called the McGill-Melzack Pain Rating Index, PRI. This is a reproducible finding. We see it in every class, year after year. In one study, 72% of the patients with chronic pain conditions achieved at least a 33% reduction on the PRI, while 61% of the pain patients achieved at least a 50% reduction. This means that the majority of people who came with pain experienced clinically significant reductions in their pain levels over the 8 weeks they were practicing the meditation at home and attending weekly classes at the hospital. In addition to pain, we looked at how much these people changed in terms of their negative body image, the degree to which they rated different parts of their body as problematic. We found that by the end of the program, they perceived their bodies as approximately 30% less problematic. This implies that negative views and feelings about one's body, which are especially strong when people are limited in what they can do because of pain, can improve markedly in a short period of time. At the same time, these people also showed a 30% improvement in the degree to which pain interfered with their ability to engage in the normal activities of daily living, such as preparing food, driving, sleeping, and sex. This improvement was accompanied by a sharp drop, 55%, in negative mood states, an increase in positive mood states, and major improvements in anxiety, depression, hostility, and in the tendency to somatize, that is, to be overly preoccupied with one's bodily sensations. By the end of the program, people with chronic pain in this study were reporting taking less pain medication, being more active, and feeling better in general. Even more encouraging, these improvements lasted. In a separate study, which looked at how people with pain conditions were coping up to 4 years after their experiences in the stress clinic, we found that, on the average, most of the big gains they had achieved by the end of the program were either maintained or improved still further. In addition, the follow-up study showed that the pain patients continued to keep up with their meditation practice, many to a very strong degree. 93% said that they continued to practice the meditation in one form or another at some level. Almost everybody reported still using awareness of their breathing during the day and other informal mindfulness practices. Some were practicing formally as well when they felt a need. About 42% were still practicing formally at least 3 times per week for at least 15 minutes at a time 3 years later, although by 4 years this percentage dropped to 30%. All in all, an impressive level of discipline and commitment, considering they had learned the practice years earlier. The pain patients in the follow-up study were also asked to rate how important their training in the stress clinic was to them at the time they were being asked to respond. 44% at 3 years and 67% at 4 years rated the program between 8 and 10 on a 1 to 10 scale, where a rating of 10 meant very important, and over 50% rated it 10 at 4 years. Responses for 6 months, 1 year, and 2 years of follow-up fell between these values, from 67% rating it between 8 and 10 at 6 months to 52% giving it that rating at 2 years. In terms of how much what they learned in the clinic was responsible for their pain reduction at follow-up, 43% has said that 80 to 100% of their pain improvement at a follow-up was due to what they had learned in the stress clinic, and another 25% said that 50 to 80% of their pain improvement was due to what they learned there. So by their own reports, the meditation training had lasting effects in terms of their pain improvements. In another study, we compared 2 groups of pain patients. All 42 people in this study were being treated in our hospital's pain clinic using standard medical protocols, as well as supportive therapies such as physical therapy. But one group of 21 patients was also practicing the meditation in the stress clinic, in addition to their pain clinic treatments, while the other group had not yet been referred to the stress clinic. Both of groups were followed over a 10-week period, the meditators between the time they started and the time they finished the stress clinic, the other group between the time they started their pain clinic treatments and 10 weeks later. We knew from previous studies that we could expect the meditators to show large reductions in pain and psychological distress on our rating scales. The question was, how would the meditators compare with other patients in the pain clinic who were not practicing meditation, but who were receiving powerful medical treatments for pain? The result was that the non-meditators showed little change over the 10 weeks that they were being treated in the pain clinic, while the meditators showed the major improvements that we expected to see. For example, the meditators showed a 36% improvement in pain on the PRI, while the non-meditators had no improvement, and they showed a 37% improvement in negative body image, while the non-meditators had a 2% improvement. The meditators also showed an 87% improvement in mood, while the non-meditators showed only a 22% improvement, and they had a 77% improvement in psychological distress, while the non-meditators had an 11% improvement. These results suggest that doing something for yourself, as the people in the stress clinic were doing by engaging in the meditation practice in addition to receiving medical treatment for pain, can result in many positive changes that might not occur with medical treatment alone. People with very different kinds of pain problems showed improvements during the program. People with low back pain, neck pain, shoulder pain, face pain, headache, arm pain, abdominal pain, chest pain, sciatic pain, and foot pain caused by a range of problems including arthritis, herniated discs, and sympathetic dystrophies were all able to use the meditation practice to achieve major improvements. This suggests that many different kinds of pain respond to the mindfulness approach, which involves, above all, a willingness to open up to pain and learn from it instead of closing up from it and trying to make it go away. Using the meditation practice to work with pain. Some people have difficulty understanding why we emphasize that they try to enter into their pain when they simply hate it and just want it to go away. Their feeling is, why shouldn't I just ignore it or distract myself from it and grit my teeth and just endure it when it is too great? One reason is that there may be times when ignoring it or distracting yourself doesn't work. At such times, it is very helpful to have other tricks up your sleeve besides just trying to endure it or depending on drugs to ease it. Several laboratory experiments with acute pain have shown that tuning into sensations is a more effective way of reducing the level of pain experienced when the pain is intense and prolonged than is distracting yourself. In fact, even if distraction does alleviate your pain or help you to cope with it at some of the time, bringing mindfulness to it can lead to new levels of insight and understanding about yourself and your body, which distraction or escape can never do. Understanding and insight, of course, are an extremely important part of the process of coming to terms with your condition and really learning how to live with it, not just to endure it. So, where do you begin? If you have a chronic pain condition, hopefully by this point you already started practicing some of the mindfulness exercises suggested in Part 1. Perhaps at some point in your reading or during meditation practice, you found yourself thinking about your own situation and from a different angle, or feeling a desire to pay attention to the things you may have taken for granted before. Perhaps you have also begun to practice one or more of the formal meditation techniques on the schedule outlined in Chapter 10. If you haven't, the first thing to do now is to make the commitment to yourself that you will make time to practice, starting with the body scan for at least 45 minutes per day, 6 days per week, and that you will keep it up even if you don't feel you are getting somewhere with it right away. All of the suggestions in Part 1 will be just as relevant to you for working with pain as they are to people who do not have the chronic pain. This includes cultivating the attitudes described in Chapter 2. Be aware of the tendency to identify yourself as a chronic pain patient. Instead, remind yourself on a regular basis that you are a whole person who happens to have to face and handle a chronic pain condition intelligently. Reframing your view of yourself in this way will be especially important if you have a long history of pain problems and feel overwhelmed and defeated by your situation and by your past experiences. You will be more aware than anybody that having pain doesn't free you from all the other kinds of problems and the difficulties people have. Your other life problems need to be faced too. You can work with them in the same way you will face and work with pain. It is important to remind yourself, especially if you feel discouraged and depressed at times, that you still have the ability to feel joy and pleasure in your life. If you remember to cultivate this wider view of yourself, your efforts in the meditation will have a much more fertile soil in which to produce positive results. The meditation may also wind up helping you in unsuspected ways, having nothing to do with your pain. As we saw when we discussed symptoms in the last chapter, making the pain go away is not a very useful immediate goal. Pain can disappear altogether at times, or it can subside and become more manageable. What happens depends on a great many different circumstances, only some of which are under your potential control. A lot depends on the kind of pain you have, For instance, headaches are more likely to disappear in a short period of time and not recur than is low back pain. In general, improving low back pain takes more work over a longer period. But whatever your pain problem, it is best to immerse yourself in practicing the meditation regularly, keeping in mind the attitudinal factors we considered in Chapter 2, and see what happens. Your daily meditation practice will be your pain laboratory. Your ability to control your pain or change your relationship to it will grow out of the body scan, the sitting meditation, the yoga, if it is advisable for you to be doing it, and out of the mindfulness you are bringing to daily living. The body scan is by far the technique that works best at the beginning for people with chronic pain, especially if sitting still or moving are difficult. You can do it lying on your back or in any other convenient outstretched position. Just close your eyes, tune into your breathing, and watch your belly expand gently on the in-breaths and recede on the out-breaths. Use your breathing to direct your attention down to the toes of your left foot. Start out working from there, maintaining moment-to-moment awareness. When your mind is on one region of your body, the idea is to keep it focused on that region, feeling any and all sensations in that region, or lack of sensations if you don't feel anything, and breathing in to and out from that region. Every time you breathe out, see if you can let your whole body sink a little more deeply into the surface you are lying on as the muscles all over your body release their tension and relax. When it comes time to leave that region and move it on to the next, let go of it completely in your mind's eye and dwell in stillness for at least a few breaths before tuning into the next region on your journey up through your left leg, then in your right leg, then through the rest of your body. The basic meditation instructions about how to work with your mind when it wanders still apply, except when you are in so much pain that you cannot concentrate on anything other than the pain itself. Working with this situation is described on this page. Namely, when you notice at a certain point that your mind is somewhere else, observe where it has gone, and then gently escort your attention back to the region you are focusing on. If you are using the body scan tape, when your mind wanders off and you realize it, then bring your attention back and pick up wherever the tape is suggesting that you focus. Move slowly, scanning in this way through your entire body. As you move through a problem region, perhaps one in which the sensations of discomfort and pain are quite intense, see if you can treat it like any other part of your body that you come to focus on. In other words, gently breathing in to and out from that region, carefully observing the sensations, allowing yourself to feel them and open up to them, and letting your whole body relax and soften each time you breathe out. When it comes time to let go of that region and move on, you can decide when that moment is. Let go of it completely. If it helps, try saying goodbye in your mind silently on an out-breath, and see if you can fall in that moment into calmness and stillness. And even if the pain doesn't change at all or becomes more intense, just move on to the next region and direct your full attention to it. If the painful sensations in a particular region do change in some way, see if you can note precisely what the qualities of that change are. Let them register fully in your awareness and keep going with the body scan. It is not helpful to expect pain to disappear, but you may feel that it changes in intensity, getting momentarily stronger or weaker, or that the sensations change, say from sharp to dull, or to tingling or burning or throbbing. It can also be helpful to be aware of any thoughts and emotional reactions that you may be having about either the pain, your body, the tape, the meditation, or anything else. Just keep up the watching and letting go, breath by breath, moment by moment. Anything you observe about your pain or about your thoughts and feelings is to be noted non-judgmentally as you maintain your focus in the body scan. In the stress clinic, we do this every day for weeks. It can be boring, sometimes even exasperating, but that is okay. Boredom and exasperation can also be seen as thoughts and feelings and let go of. As we have mentioned a number of times, and it is true of the body scan in particular, we tell our patients, you don't have to like it, you just have to do it. So whether you find the body scan to be very relaxing and interesting or difficult and uncomfortable or exasperating is irrelevant to whether it will serve you well. As we have seen, it is probably the best place to get started in this process. After a few weeks, you can switch over to alternating it with the sitting meditation and with the yoga if you like. But even then, don't be too quick to give up on the body scan. Also, do not be overly thrilled with success or overly depressed by lack of progress as you go along. Every day will be different. In fact, every moment will be different, so don't jump to conclusions after 1 or 2 sessions. The work of growth and healing takes time. It requires patience and consistency in the meditation practice over a period of weeks, if not months and years. If you have had a problem with pain for a number of years, it is not exactly reasonable to expect that it will magically go away in a matter of days just because you have started to meditate. But, especially if you have tried and everything else already and still have pain, what do you have to lose by practicing the meditation on a regular basis for 8 weeks or even longer? Is there something better you could be doing in those 45 minutes per day than touching base with yourself, no matter what you think or feel at those moments, and dwelling in the domain of being? At times of discouragement, just watch the feelings of discouragement themselves and then let them come and let them go too, as you keep practicing. When you encounter moments when the pain is so intense that it is impossible for you to direct your attention to any other part of your body, let go of the body scan, shut out the tape if you are using it, and just bring your attention to focus directly on the pain itself in that moment. There are a number of ways to approach pain besides those we have already discussed. The key to all of them is your unwavering determination to direct your attention gently, delicately, but firmly on and into the pain, no matter how bad it seems. After all, it is what you are feeling right now, so you might as well see if you can accept it a little bit at least, just because it is here. In some moments when you go into your pain and face it openly, it may seem as if you are locked in hand-to-hand combat with it, or as if you are undergoing torture. It is helpful to recognize that these are just thoughts. It helps to remind yourself that the work of mindfulness is not meant to be a battle between you and your pain, and it won't be unless you make it into one. If you do make it a struggle, it will only make for greater tension and therefore more pain. Mindfulness involves a determined effort to observe and accept your physical discomfort and your agitated emotions moment by moment. Remember, you are trying to find out about your pain, to learn from it, to know it better, not to stop it or get rid of it or escape from it. If you can assume this attitude and be calmly with your pain, looking at it in this way for even one breath or even half a breath, that is a step in the right direction. From there, you might be able to expand it and remain calm and open while facing the pain for maybe 2 or 3 breaths or even longer. In the clinic, we like to use the expression putting out the welcome mat to describe how we work with pain during the meditation. Since it is already present in a particular moment, we do what we can to be receptive and accepting of it. We try to relate to it in as neutral a way as possible, observing it non-judgmentally, feeling what it actually feels like in detail. This involves opening up to the raw sensations themselves, whatever they may be. We breathe with them and dwell with them from moment to moment, riding the waves of the breath, the waves of sensation. We also ask ourselves the question, how bad is it right now, in this very moment? If you practice doing this, you will probably find that most of the time, even when you are feeling terrible, when you go right into the sensations and ask, in this moment, is it tolerable? Is it okay? The chances are you will find that it is. The difficulty is that the next moment is coming, and the next, and you know they are all going to be filled with more pain. The solution? Try taking each moment as it comes. Try to be 100% in the present in one moment, then do the same for the next, right through the 40-minute practice period if necessary, or until the intensity subsides, at which point you can go back to the body scan. There is another very important thing you can do as well as observing the bare sensations themselves. That is to be aware of any thoughts or feelings you are having about the sensations. For one thing, you may notice that you are talking about them silently in your mind as pain. This too is a thought, a name. It is not the experience itself. Notice it if you are labeling the sensations in this way. Maybe it is not necessary to call them pain. Perhaps it even makes them seem stronger. Why not look and see for yourself whether this is so? There may also be all sorts of other thoughts and feelings milling about, appearing and disappearing, commenting, reacting, judging, yearning for relief. Statements such as, "This is killing me," "I can't stand it any longer," "How long will this go on?" "My whole life is a mess." "There is no hope for me." "I'll never master this pain," may all move through your mind at one time or another. You may find such thoughts coming and going constantly. None of them are the pain itself. Can you be aware of this as you practice? It is a key realization. Not only are these thoughts not the pain itself, they are not you either, nor, in all likelihood, are they particularly true or accurate. They are just the understandable reactions of your own mind when it is not ready to accept the pain and wants things to be different from the way they are. In other words, pain-free. When you see and feel the sensations you are experiencing as sensations pure and simple, you may see that these thoughts about the sensations are useless to you at that moment, and that they can actually make things worse than they need be. Then, in letting go of them, you come to accept the sensations simply because they are already here anyway. Why not just accept them for now? However, you cannot reliably let go into accepting the sensations until you realize that it is your thinking that is labeling the sensations as bad. It is your thinking that doesn't want to accept them now or ever because it doesn't like them and just wants them to go away. But notice, now it is not you that won't accept the sensations, it is just your thinking, and you already know, because you have seen it for yourself via stand, that your thoughts are not you. Does this shift in perspective show you another option for facing your pain? What about letting go of those thoughts on the purpose as a little experiment when you are in a lot of pain? What about letting go of that part of your mind that wants things to be the way it wants them to be, even in the face of incontrovertible evidence that they are not that way right now? What about accepting things just as they are right now, in this very moment, even if you hate them, even if you hate the pain? What about purposefully stepping back from the hatred and the anger and not judging things at all, just accepting them? It may also strike you at a certain point, particularly if there is a moment of calmness in the midst of the inner turmoil, that your awareness of sensations, thoughts, and feelings is different from the sensations, the thoughts, and the feelings themselves. The part of you that is aware is not itself in pain or ruled by these thoughts and feelings at all. It knows them, but it itself is free of them. When practicing the body scan or any of the other mindfulness techniques, you may come to notice that when you identify with your thoughts or of feelings or with the sensations in your body or with the body itself for that matter, there is much greater turmoil and a suffering than when you dwell as the non-judgmental observer of it all, identifying with the knower, with awareness itself. We adopt this witnessing perspective throughout the meditation practice, but toward the end of the body scan tape, there is an explicit sequence that encourages what we have called choiceless awareness, a disidentifying with the entire play of inner experience, whether it be the breath, sensations, perceptions, thoughts, or feelings. As the body scan comes to an end, after we have intentionally let go of it, we invite our thoughts and feelings, our likes and dislikes, our concepts about ourselves and the world, our ideas and opinions, even our name, into the field of awareness, and we intentionally let go of them as well. On the tape, it then suggests that you tune in to a sense of being complete in the present moment as you are, without having to resolve your problems or correct bad habits or pay your bills or get a college education or anything else. Can you identify with yourself as being whole and complete in this moment, and at the same time part of a larger whole? Can you sense yourself as pure being, that aspect of you that is beyond your body, beyond your name, your thoughts and feelings, your ideas, opinions, concepts, even beyond your identification of yourself as a certain age or as a male or a female? In the letting go of all of this, you may come to a point at which all concepts dissolve into stillness, and there is just awareness, a knowing beyond anything to be known. In this stillness, you might come to know that whatever you are defined nightly, not your body, although it is yours to work with and to take care of and make use of. It is a very convenient and miraculous vehicle, but it is hardly you. If you are not your body, then you cannot possibly be your body's pain. As you learn to dwell in the domain of being, your relationship to pain in your body can undergo profound changes. These experiences can guide you in developing your own ways to come to terms with pain, to make room for it, to live with it, as so many of our patients have. Of course, regular practice is necessary, as we have been stressing all along. The domain of being is easier to talk about it than to experience. To make it real in your life, to get in touch with it in any moment, takes concentrated work and determination. A certain kind of digging, a kind of inner archaeology, is required to uncover your intrinsic wholeness, covered over as it may be with layer after layer of opinions, likes and dislikes, and the heavy fog of automatic unconscious thinking and habits, to say nothing of pain. There is nothing that romantic or sentimental about the work of mindfulness, nor is your intrinsic wholeness a romantic or sentimental or imaginary construct. It is here now as it always has been. It is part of being human, just as having a body and feeling pain are part of being human. If you suffer from a chronic pain condition and you feel that this way of looking at things resonates with you, then it may be time to test this approach for yourself. The only way to do so is to start practicing and keep practicing. Find and cultivate moments of calmness, stillness, and awareness within yourself, using your pain as your teacher and guide. It is hard work, and there will be times when you will feel it like quitting, especially if you don't see quick results in the terms of pain reduction. But in doing this work, you must also remember that it involves patience and gentleness and loving kindness toward yourself and even toward your pain. It means working at your limits, but gently, not trying too hard, not exhausting yourself, not pushing too hard to break it through. The breakthroughs will come by themselves in their own good time if you put in the energy in the spirit of self-discovery. Mindfulness does not bulldoze through resistance. You have to work gently at the edges, a little here and a little there, keeping your vision alive in your heart, particularly during the times of greatest pain and difficulty.